for fluoridation.
Wow.
Okay.
Yeah.
Now, all I can say is, and there's a practical matter. You're weighing a practical matter against an ethical matter here, and you've got to make the decision. I think, in the end, I really think in the end, by being truthful, by being straightforward, by admitting your mistakes when you make them, you're going to get ahead. Sometimes it takes a little while. I think you're riding on the back of work that I did, because there's no question that the proponents of fluoridation have lied and lied effectively over the years. And I've been into this battles for about 21 years. And I'm still alive. I mean, I've gotten my meals, I live in a house, it doesn't leak on me, and all this type of stuff. And the hens are now coming home to roost. People are seeing that these people have been lying to us for 40, 50 years. I mean, how long can you cover up the fact that fluoride causes 10,000 excess cancer deaths a year? Well, you can say, well, it's due to demographic variables. They didn't look at the number of marijuana smokers here. Now their own tests show that fluoride causes cancer. In the end, you're going to win. And you're going to win faster now, I believe, on top of our victory with fluoride. Because this idea of everyone saying the emperor's wearing a full set of clothes when he's as nude as can be coming down the street. In Hans Christian Andersen's story, it was all that was needed was one kid to remind everybody that he wasn't wearing anything, and everyone laughed. Now, you can have a biochemist who's telling there's no reduction and it's harmful, and it takes so much more now because people are resistant. People are resistant. People have accepted the norm that, well, what does somebody else think? And they won't come out. They're so afraid now. Things are worse now than they were in the times of Hans Christian Andersen, by far. We need a philosopher like Hans Christian Andersen to write a news story now, where the kid says, look, the emperor has no clothes, and his head is cut off. And another person does it, and his head is cut off. And that's more like what's going to happen today. And it's just some people who won't stand for it. And quite frankly, if your therapies work, you've got to put them out there correctly. Good PR, bad thing that happened about fluoridation, I'll tell you, we had some of the worst PR, the little old ladies in tennis shoes and communist plots and all this type of thing. Now we had so many negative factors we had to fight. You don't have that. And this is why, on the solution thing I have, influencing legislation, restricting authorities to reasonable investigations, which is what you're talking about. Now somebody came to me, I think it's a harebrained idea. Public relations, it means getting involved, getting in the media. You're going to decide whether you want to be an underground organization that is just going to deal with, don't tell any other dentists if you're having this thing done here. You should be out there. If you got something that's good, you don't keep it hidden. You go out and do radio programs. You go out and do TV programs. You explain to people what's going on. I mean, if they can do it with a fraud like fluoridation, you should be able to do it with something that works. And the idea of acknowledgement of new modalities. We've got to have some type of legislation in the states that you're practicing in that acknowledges new potential modalities. You're not going to have something come and hit and be taken immediately as being true. You've got to develop your story. You've got to develop PR. You've got to have either good science, and if you're working not in science, good whatever it is. Good statistics, if not science. Because science usually looks for a way of explaining it, records and observes and records facts. And you can, through science, just say, well, I don't know how. I've got a black box here. I don't know how it works. All I know is when I test my patient like this, the test positive, that it's indicated this tooth be removed. The more ignorant you are, the better off you come. We take that tooth out, Dr. Rand. I have run so many histopathological, reports on this. Every single one that I have removed that this thing indicated was bad, causing low-grade infection. Now, I'm not a multiple genius. I mean, this is one way of saying, I don't know how it works, but it works. And there's lots of things. We don't even know how aspirin works. We still use it. Well, we do. We do what? Well, we use it. we as a profession, because your medical colleagues do use it. Now, I didn't say all of us use it, I said we use it in the sense of the profession. We use lots of things we don't know how they work. Every time I eat an apple, I'm not quite fully sure how it works. I know it gives me calories, it gives me vitamins, minerals, performance enhancing factors, but I know there are things in an apple or an orange or a pear or something like this. I don't know how it works. It's not going to stop me from eating apples anymore. I mean, I probably know more about the breakdown of food. I tell you, about 400,000 different fats. You know that? 400,000 different fats that we can conceive of. I mean, I could write them up on the board if I had enough time. How each one of them works, I don't know.
Well, we're kind of like that little kid that laughs at the emperor. We're trying to get an iron collar before we make too much noise.
Well, I think I can help you do that.
Oh.
And I think an attorney can help you also.
There's other things that are coming about too. You know, there's research that's being continually done. There's some more studies that are in the process. There's states right now that are adopting a policy of trying to get bills initiated where they would have to declare what's in an amalgam filling. I mean, there's other things that are involved. If we can hang in there long enough that our heads aren't chopped off, then it's going to come our way. But if we go out and make a lot of noise, I can tell you right now in Arizona, they'd come down and they would say, you're making fraudulent statements. Therefore, they can discipline you, they can take your license away, they can do a lot of things.
Yeah, this is where a combination of a scientist and a lawyer can help you develop a case that you're going to present in front of the public before you do it.
Yeah. Well, it gets a little bit more intricate too when you figure that licensed professionals, in the end, most of them don't want to be martyrs. Occasionally you run across someone who's crazy and wants to be. But you make this presentation, and even if they don't get you on the basis of your science, very few don't have some mistake in how they're billing their patients or something that they're doing, even if it's out of ignorance. It doesn't even have to be knowledgeable fraud, but even out of ignorance, especially with the Medicare system, that you're making a billing error, and they can come down and jump on you for a billing error and fines for $500,000 and.
How many Medicare fines? How many people have a Medicare fine this room for $500,000? No. Anyone?
No one here.
No one here.
The couple that I know aren't in practice anymore.
They were fined $500,000?
One of them was fined $225,000. The other one was fined $290,000.
$290,000.
Yeah.
For doing what? False billing?
For fraud.
For
Yeah.
fraud.
For billing for services that
How much money
weren't appropriate.
How much of the money do they get in by billing this way? Did they get that much money in?
Oh, I haven't got the thing. No, they certainly didn't get that much money in from that billing. But I think they were lucky because they were pretty clean. I know physicians who have.
I don't think a person who's clean and
gets
gets fined, $290,000 is lucky. I think they got either a bad lawyer or they got a bad legislature.
That may well be, but there are those situations, even out of ignorance.
Now, who paid for that? Did the insurance company pay for it?
In the case of, I don't know who did. In the case of fraud, I don't know who paid for that.
They paid for it.
The insurance won't cover it, right?
Insurance won't cover
be
fraud.
covered.
They
Not
won't
if it's
cover
criminal.
fraud.
No, not if it's criminal.
But
But you see, there's
that's
also, let me tell you something else. I'm not a lawyer, but I do know standards of proof. There's 3 standards of proof. One's called preponderance of the evidence, clear and convincing, and beyond a reasonable doubt. Criminal, it's got to be proven beyond a reasonable doubt. And usually it's in front of a jury. If they can show fraud beyond a reasonable doubt with a jury award or a fine or something like, the judge will set the fine, with a fine of $290,000. I don't know who your friends are, but they must have a bad attorney if they're clean.
well, you don't have to be proven criminal to get the fines.
It's criminal fraud.
Well, you
But
don't
it
have
doesn't
to
go to court.
Doesn't have to
You
go to
don't-
court.
It is not due process. That's
No,
another
there
big
is no
problem
due
with
process.
Medicare.
Oh, Medicare, okay. It's an administrative hearing, right?
Medicare kangaroo
It's
courts.
an administrative hearing. You have an administrative hearing before their kangaroo court.
Yeah.
Unfortunately, they set the record that way. Then you can appeal it.
Yeah, you can appeal it to a court then.
Then,
That's if you can afford it.
well,
After you've been through the front page of your newspaper and all the other vilification.
oh, I know that. I mean, I'll tell you this
So
one thing.
whether or not that's defensible is
Yeah.
one thing, but that's a significant fear that practitioners have. Now, the only resolution to that is what we're talking about today, is to bond together, to, instead of waiting to have to defend yourself, to be offensive.
Right. Well, you're talking my game now. And I'll tell you one thing, the administrative hearing process is something that doesn't just exist in your medical board. We have environmental hearings, we have all types of administrative hearings, and they've got to go. They've absolutely got to go. Because I cannot tell you how bad it is to set the record in front of an administrator, okay, who is hearing his own colleagues say bad things about you. I mean, it's his own colleagues that are doing it. Again, it's the fox guard, the hen house. It's a type of legislation that not only would your group be in favor of, but even environmental groups would be in favor of, because they don't like, if they have a gripe about somebody polluting somewhere, or if they're being unjustly accused of doing something, to have the EPA already take a position on it, and then have the EPA hear it. It's really denial of what they call due process of law, which is a constitutionally guaranteed right. And that's something that's got to go. But these are the types of things I'm talking about when I say in the deluxe plan, influencing legislation. We've got to get legislation in there that if they're going to forget about our constitutional rights, then let's put it into law. Let's make it a statute. Or how many people are from California here? How many people are not from California? Okay. In the few states that you're from, and in California in particular, even somebody was mentioning in the other room about a health rights amendment, getting something into the Constitution of the state of California that can't be voted out, that would guarantee you due process and say administrative hearings cannot take the place of a full court hearing. That you have, if you want to have an administrative hearing, that's fine, but you can ask for a trial in front of your peers at any time. That will save a lot and make it a lot easier for you to defend. You're not getting an impartial trier of facts every time you go to an administrative hearing. It's like going before the king, because the king is the executive branch. The administrative branches are under the governor. That's not separation of powers. That's not, your rights are being really, really stamped on.
Well, that's how it is with the state board.
It's not really
the same thing. State board.
State board, that's what I'm talking about.
It's exactly the
It's
same
an
thing.
administrative hearing.
Absolutely. And they can subpoena you, you have to show up, I mean, it's,
They can close your office down, can they, without a hearing?
I don't know
Take
if
your
they can do
license.
that, they can take your license.
Take your license?
They can do that, they
Well,
can
they might
put
as
you
well
in
shut your
jail.
office down.
That's right.
They can put you in jail if they wanted to. Keep practicing, they could.
Yeah.
A comment I have is concerning the scientific evidence of this electrodiagnostics. And until today, I did not have a clear idea about the data concerning fluoridation. I mean, I was using fluoride this week in my office.
Sure.
But today, I've been presented, and what I've been taught has been properly put in perspective, and I understand now studies, et cetera. So I'm clear now about the data. I can now, with some conviction, present a stand to people because I know what I'm saying, and I have something to give people to back up. Okay. Now, when I came into this bioenergetic evaluation system, I really didn't know what I was doing on a scientific basis, and I have a strong scientific background. I have a biochemistry degree too. And even today at lunch, Gary was talking and saying that certain results of testing that I actually paid money to somebody who tested me so I could try to verify and see if I could come up with the same results. And Gary was saying, actually, you could go to several people and they would not agree. So that, to me, is a serious problem. And you would appreciate this very much. So I think if we, in other words, from a scientific perspective, we don't have our act together. It doesn't sound like we can scientifically present this in the form of legitimate evidence. Now, this is what I'm seeing, just based on, maybe Gary can speak up, and we can speak up. I'm confused about whether this is objectively, scientifically.
So I'm going to go home and I'm going to get 2 papers by Fuller Oil, and it addresses that subject. And what you're dealing with is you're in an area of quantum reality, okay? It's not a reality by consensus, like the Dental Association. It's a reality of time and space right there and then. Every individual is operating, he's measuring the patient and the patient's allowing himself to be measured. It's a different arena if we change one of the partners or a different machine or a different person. You may come up with different answers. The net result is how these therapeutics are utilized in the treatment of the patient and whether it alleviates the patient's problems or cures the patient, okay? Or starts self-regulation and self-cure is what it really does. And if that's the case, then it doesn't make any difference whether it's XYZ or ABG or PQM. If the net is that if that works, it works. And the only way you can do it is to try it. When we were in Hawaii, we saw Dr. Rossman who's taken a computerized Vohl's method of analysis by measuring points. How many points they're measuring now? I think 150 or something. It goes in his computer. The net result is you don't need to know anything about analysis to do this. All you have to do is find the energy that balances it. And when you use those energies in a consciously applied manner, let's say they're homeopathic energies or phytotherapeutic energies, like they've been traditionally used, you'll find that the patient will get better. And it'll be almost like a miracle. I mean, and you don't have to have any consciousness about diagnosis. You don't have to know about any drainage remedies. You don't have to know about anything. If you spend the hour, you'd have to go through maybe 2 or 3, 5,000 ampules to check all of these. And if you found a half a dozen or a dozen that really balanced it out and verified and checked again and verified and checked again, you would have a dynamite remedy for that patient.
Okay, I understand
Because
that.
it's based on energy application.
Okay, but that's a different model, okay? What I'm asking, and I'm asking John here, on a scientific arena, would that be a reasonable stand right there?
Well, let me say how I would deal
Because
with
it's not
this.
accepted.
Let me say how I would deal with this. If we arrange something, you know, some type of a contractual agreement, where it came in and served as your basically science counsel, not your legal counsel, legal counsel along with it, I would have to learn and find out from the best people who are in the field what's going on. I want to have all their evidence. And my tendency usually is, as a plaintiff's witness, is to attack everything. I would cut things apart more than you'd ever have it cut by the medical board, because then I'd right anything. And I would have the questions answered. And then I would set up a recommended statement of what you can actually say about your treatment. And if it deals with energies, we don't exactly know, but the whole thing is this, that we know when we do it, the patient gets better. If we have a patient who's in one state, then in another state, after the treatment, we have no idea of why that treatment works, whether it's energy fields, electromagnetic radiation, auras, curling photography, witching sticks, I don't care what it is. If we have an association between a treatment and an improvement of health, that's all you need in science. That's all you need. Observation, classification of facts. You don't have to show exactly why it happens. You can. The only thing we ever do in trying to say why something works is based on theories we have of why it works. And those theories are only as good as until the first exception that comes along that shows that theory is wrong, that we develop a new set of theories to show why it works. The fact that it works is a scientific fact. And that's what I go for. Now, to answer one other question, you'd be afraid the medical quality board would get down on you. What I would do is I would have a hearing in front of the medical board, medical assurance board, before the first person even referred somebody to someone else. And I say, this is what is being done out there. I want you within 10 or 15 days or 30 days to get back with me to tell me why there's anything wrong with this. And if you don't, I assume that you have nothing to say against this. You will not harass any of our members.
They won't accept anecdotal
They won't.
statements.
My stuff will not be anecdotal statements.
If it's not scientifically verified as an anecdotal to
Wait a second. You know what science is? I have it. Unfortunately, I have my book High Performance Health. But
It's usual and customary treatment in the community.
Now, science deals with nothing more than the observation through any of the senses, eyes, ears, nose, a sense of feel.
Have you been before a board before?
Have I been before a board before? No, it's a good thing. I haven't been before a board before,
Oh,
for
you
the
need
board's
to be.
sake.
I've got one coming up. You want to come over and visit me? I'll let you sit in front of them.
I have no problem with it.
The problem is that with the board of
They're not
dental
logical.
examiners or board of medical examiners, you have to perform treatment within the realms of guides of what's performed in the community
That's
as
right.
the mainstream, not this little splinter
Not
group or
right
that little
or
splinter
wrong.
group, but the
Well,
mainstream.
not right or left.
That's what they allow you to practice dentistry for. I
Yeah.
mean, that's what your basis of your license is. If you don't do that, you're not
But
practicing dentistry as
But-
they see it.
if you get an IND to do it, you don't have to worry about
I'm not even sure about that.
But what John's saying is that there's an avenue of how we can impact change, and I think that's excellent.
Good.
And I think some of our concepts.
it. And then then your data won't be anecdotal.
Exactly.
My question is, does the board even know what it is?
IND?
Yeah.
I'll write
I think I've got some board members.
I'll write
already
them a
aware.
letter.
I never
I'll
even
ask
heard
them.
about
I'll
it.
ask
How
them.
would they know about it?
I'll ask them. I'd ask them.
I guess I'll have to just butt in to be,
Sure.
have a chance to talk.
I'm sorry.
My perspective is that, as a group, we're not cohesive enough. We haven't defined what our real goals are, what exact therapy modalities we want to become
Covered for.
standardized. And we don't have enough of our homework done to really even be represented by anybody at this point. Everybody in here is their own island. We're all practicing our own specific way. There's no cohesiveness there. And we have a lot of groundwork that we could do that would facilitate anybody that we hire to work for us.
Mhm. Well, there's a couple of ways of doing it. What you're saying might happen. It's the ideal way, but it should have happened already. The other way is to have a person like myself come with you and make it happen, pull it out of you. I mean, many of you may not be able to get together at the same time, but I can get together with 1, 2, or 3 of you and pull it out of you and make sure that you get your act together and decide what your modalities are. And there are going to be still people within the group who want to go outside those modalities anyhow. And it may be hard for us to cover those people. But we want to get some cohesive story together that is defensible in court. Really, here's the damn thing.
John,
Yes.
I'd like to address Linda's
Sure.
comment. We already stated our goals and purposes in the promotional literature for the academy. And what we first did was we first tried to understand what the Germans, what they did and what their concepts were, and they've imparted almost all this information to us. They've been a little bit slow with publishing companies in translating a lot of biological, medical, and dental literature into English, and we've taken that responsibility. And we're doing it. We've got more things published, and we're going to ask people again for funds to help this translation fund. Well, we've done this, and we realize that we have to have a protocol thing. And Bob, and you can be on it. In other words, we want to outline what it is that we want to become and how we get there. We want to certify people to do this, and we've been asked by the clinical colleges to start a college to certify it, to give diplomatships and all this thing. But do you realize what a tremendous field this energy field is? Once you leave the safety of academic constraints on the curriculum of understanding, that opens up the whole universe to the application of disease problems. And this is it's unbelievable. I mean, it's just like, it's an unbelievable thing, because everything has therapeutic utility. You just have to know how to use it, that's all. And so we want to do this, and we want to see this become reality. We're kind of waiting for the physicians to get in and carry the ball. All they want to do is change the name of this group to medicine and dentistry, which is a good idea. But we didn't see anybody volunteering. Hey, I want to come over. I want to help you. We want to do this. And one of the things, we had one of the guys that, Denny, was doing our editing. We have another journal coming out. It's a dynamite journal, the best one we've done so far. And he kept putting it off and putting it off, and now the time has passed, and maybe we'll get it at the end of the month. I'm not blaming him. I'm glad he's doing it. But we want some help from everybody, and I know you're a volunteer, and you'll do this, and this is what we want to do. We intend to make this a curriculum. In the new journal I wrote about dentistry's foot being in the door. We had an opportunity to get certified in acupuncture at UCLA, and the fellow that started the program and spent 7 years trying to get this curriculum so that dentists could take this to become certified acupuncturists, wants to know all about biological medicine and dentistry. And they're pretty open down there in Lotus Land, and they're ready to start having people come and talk to them about what it is. You know, it's more than just toxic metals. It's like I said before, it's electrogalvanic direct currents and a physiology that's wrong with electrical currents. What is it doing? What's it shorting up? We don't really know. We got people the caliber of Robert O. Becker that's really interested in this problem. Maybe we should have some money to look at it, but he doesn't. We want to look at the whole problem of hidden infection and why are these things going undetected by the general population, because it's there. And then the third thing is the detoxification. Now, if you believe in all of those four things, you're going to fly in the face of these people that got the status quo. They don't want to see any changes, especially the hospitals. You ask yourself, why do they want things to continue? They're having trouble making ends meet, and they want sick people.
Right. Remember one thing, I think you're all forgetting the patient. And every time you help somebody by removing those amalgams, it's no crime to ask them for their support and give you a letter of recommendation. I have a book that thick on people, even the dentists that have referred to me in prevention, that have received the rewards that we have to offer. So start with your own little brochure in your office and let others read it that come into your office.
Well, we're going to be working on the protocol and what we want to talk about, or what we want to accomplish.
No, I think it's, so far, we're right on track. We've got to have some type of cohesive story, if I can use the word in quote, story, or case to present, that we all generally agree on.
Wouldn't it be easier to target one specific thing than just try and jump at every modality? It seems to me that the mercury issue is the easiest one to defend.
Well, there's no question that the mercury is.
And then, how do you move an elephant? You cut up into chunks and move it.
The mercury issue is fast sliding into oblivion.
But we haven't won on that score.
Give us a couple of years, and things are going to change drastically. There's, as I said, the first international symposium in English on amalgam fillings. They're going to talk about it, and they've got legislators and environmental groups. This is the one in North Carolina. They're publicizing more information from the VIMI studies, the pregnant sheep up in Canada. All of these things are important, and they're getting more press throughout the world on the amalgam issue. Donder in Germany, the physician in Munich, come out in the paper there and said it's malpractice to use amalgam. In other words, and there's a big stir going on over there. It's just a matter of repetition and increasing the consciousness. And the more you can talk about it, the more you can get involved. Like John said, don't be afraid to go to a talk show. You got to stand up. You got to be counted. If you don't, your life is going to be over, and then you're going to die with all this knowledge, and nobody's going to benefit from it.
I think there's a question out there by show of hands. Is there anybody here who would have any problem if a person had any question as to whether their mercury fillings should be taken out, say referring them to another dentist for a second opinion? Anybody would have any problem with that? Raise your hands. Two people.
What are you talking?
You mean to
Are
another?
you talking about someone comes in and blanket all
No.
fillings should be replaced?
Somebody comes into your office and you take a look at their mouth and you see mercury fillings and you think that something that they are suffering may be due or is due to the mercury fillings in their mouth. And you recommend that they be removed for the purpose of possibly taking care of some of these toxic problems they seem to be having. Now you tell.
Go the next step for them.
Then the next step is, now you say, okay, before I remove these, I want you to go to another dentist and get a second opinion. He may or may not agree with me, but I just want you to get a second opinion on it.
Now go to the next step. he says baloney. This is the biggest piece of crap that's ever come down the way. The ADA is against it, and you should
Right.
be very careful.
Right. Person comes back to you and either has or does not have those mercury fillings removed. Is that a problem for most of you here? How many people wouldn't mind it by show of hands? 'Cause-
What do you gain by it? I don't.
Well,
I'm
right
not a
now,
dentist. I'm not a dentist.
right now, are you having problems? Because I was in front of a ZIFS group, and their group is still having problems, with the medical board or, dental board getting on their backs because they're removing mercury fillings. I mean, you can remove them, I forget what it is, you can remove them if they
aesthetics.
want it for cosmetic
Yeah, right.
purposes,
Yes.
but you can't remove it for medical purposes.
No, if you claim they're toxic, you cannot.
Or if you claim that they're toxic.
All you have to say is
If
they're
you
toxic.
can't prove it.
Now, if you can prove they're sensitive, it's all right. Or because they want white fillings, but not because they're toxic.
Or if you get some MD to say it's all right.
But can you say, from what I understood at the convention in Michigan, from what I understood, you can't even say, I suggest removing the fillings because they may be toxic. They
That's
may
right.
be the cause.
That's
You
right.
can't do that, can you?
No, you
Okay.
cannot even use the word toxic.
That's being unethical.
That's right. It's on the verge of being a quack and fraudulent.
So right now, you don't even do that, do you?
No, I don't.
No one does. How do
I
you do
do.
it? You do.
They do.
Now, how do you replace these mercury fillings?
Okay, the way I do it is I go through a sensitivity test.
Yeah.
And the sensitivity test tells me whether or not they have any problems with it.
A blood test?
A blood test.
Is that acceptable?
Well, right now it is. Hasn't been
Because it hasn't been
disproven.
tested.
Hasn't been disproven.
Right. I mean, I really think mercury is still a problem.
Generally
Oh,
accepted
yeah.
in the community by physicians and dentistry is if you do a serological testing the IgG, IgA, and IG, whatever the heck the rest of the stuff is, against different components of dental materials.
Yeah.
And it shows up that the person has sensitivity, whether it's medium, strong, or weak, to different components of amalgam, whether it be the tin or the silver, or the aluminum or the mercury, whatever it is. Then you have a case that you can say, okay, now this is, something that's accepted here.
So it's a serological test then.
Yeah, and that's
Justified.
one way of doing it to protect your fanny.
Yeah.
You may find, using the diagnostic instrumentation, different things in there and more things that the patient needs as far as detoxification and or removal. But you don't necessarily have to say, well, this is, what's going on. I'm going to remove your amalgam fillings because you're sensitive to this stuff. That's
So
kind of
basically, the problem here, I think, is more legislative than it seems to be.
Absolutely. It's,
Well, what I see is that the law is that the electromagnetic diagnosis cannot be the primary reason for recommendations because it is not considered an
Oh,
acceptable.
right. No, I'm just talking about mercury fillings, period, right off the bat. Are there people in this room, how many people in this room, and really, if you're awake and energetic, raise your hand. How many people in this room believe that every mercury filling in a person's mouth should be replaced? How many people don't? Okay, so there seems to be at least more general agreement on that, but there is even there, some people, I mean, I have some mercury fillings in my mouth. And obviously if I...
obviously, you don't believe it.
No, I mean, I've I hate to say this because Dr. Wren is here, I was probably unintelligent enough to use composite fillings to replace them with, and I hear that might be just as bad, I don't know. But, I mean, I do have composite fillings now, and I do have some gold. So, I mean, there's enough concern that I have not continued to do the same thing, but I still have probably a couple of amalgam fillings. I don't think I have maybe more than, I haven't looked, maybe 2 or 3 or something like that.
One of the difficulties is that we don't have all our ducks in a row. We're pioneers, right? The field we're working in has an end result that is beneficial under certain conditions, right? Mercury amalgam is only the tip of the iceberg. And that's one of the problems that you run into if you say, okay, mercury needs to be replaced. You deal with the fact that you have a sensitive patient, you rip all the mercury out, you can make them sicker than leaving some of it in.
Yeah.
Secondly, you deal with the mercury, you're not necessarily dealing with underlying infections. You're not dealing with a whole lot of other things. And there are people out there who are beginning to get onto the bandwagon. Okay, mercury is toxic, so let's take it out. They're ripping mercury out without concern for lymphatic drainage or half a dozen other things, and people are getting sicker, and so that's pulling the movement back some. So it's a complex of things. It's not just that mercury's bad for your health. Fine, great, we can prove that in the laboratory, but it is also in the grassroots that people are seeing that yes, some people have dramatic remissions from even severe illnesses, and yet some people are getting worse as a result of this quackery of removing mercury fillings. And so there's some uneasiness there. And we don't have enough of...
But I think we have enough data right now. And
well, there's enough data
I have to agree
accumulated.
with Dr. Rand. I think we have more data on the toxicity of mercury in fillings than we do for electroacupuncture. I mean, I have read some of the articles on it.
I don't know about that.
We do know. We have quantitative measurements about the amount of mercury that's coming off.
About it, the amount of mercury.
We do know that mercury is toxic.
The data that we have for electroacupuncture, a whole lot of it is still in German.
Okay.
So getting some of that translated, and also getting the impact of mercury or the diagnostic ability of electroacupuncture into the public realm or into the professional realm even in some significance, so that there's enough support. I mean, if you have 10 people who are trying to support an attorney and a science consultant, as opposed to 100 people or 500 people trying to support that same effort, you get a little bit further with your buck, and a little bit further with your impact on the public as well.
But
You
John,
also also assume a greater liability.
John,
You're not gonna have,
there's
sorry.
something else involved, and that is, in Arizona, homeopathy and electroacupuncture is part of the law. The same, it's also in Nevada. In California, it is not. And they attacked it from a legislative point of view and got it passed. They have their own homeopathic medical board in Arizona and in Nevada.
Yeah.
We do not have it in dentistry. 2 words would have to be changed in the Dental Practice Act in order to do that.
That's a legislative function.
It's a legislative function.
But you see,
And if
I
you're
still
gonna come-
maintain that a lot of your problem can be taken care of by an IMD for electroacupuncture, which means that you're telling your patients that you don't fully know they're involved in something that you have indication to believe is helpful, and that is how you're treating your patients, and I don't think you're going to have the problem that you would have otherwise just going in right now. I don't care how many referrals you make. You have an IND, you're admitting to your patient right off the bat, this is investigational. I mean, I'll tell you one thing, I'd rather have a tooth pulled out because of some electroacupuncture diagnosis than I would to take AZT for AIDS. And AZT is IND, by the way. It's not approved. I don't think it is. Has it been approved now?
Yes, it's not.
FDA approved?
It's
It is
now
now.
approved.
Okay. That's why I was telling you the other day, just earlier this morning, that FDA approval does not necessarily mean
Right.
it's safe.
Would you
Yeah.
go back to your second opinion thing? Did you finish that point? Is it finished? Did I miss something?
No, I don't know. Let's talk about it.
Okay, you said, if I'm gonna, it's almost like I'm a snowball, and one of the things I wanna do is to take the oven test. That's how, in practicality, that's what's going on here. When I send patients out, because I think they're food allergy, I think they're eating so damn much sugar that they're driving the vitamins and minerals out of their body. I know damn well a lot of them are yeast infected and that's being missed, etc. Okay, in my astute little group there in my hometown, who am I gonna send that out to a referral? It's the snowball test. Now why? Is that over?
You don't have to. You don't have to. I'm just saying it's something you might consider if you're going to go into something
I thought maybe
that
you
you
were saying
might
you have
feel.
to do this.
No, you don't have to do it. That you feel that you would be more protected if you told this person to go out and get a second opinion. Have a person sign it on the line, send them to another dentist or physician or whatever it happens to be, get their signature. All I'm saying is going into a court case then, you have covered your ass a little bit more.
Because that does cover you more, even though they give you an adverse opinion.
You have not, you have not. I mean, if you can show the patient who came to you that's now complaining about you
Yes.
had either confirmatory advice or contradictory advice,
But they still came to me.
but they still came to you and took the treatment, you're gonna be better off.
Yeah, 'cause it's striking as a
What
consent.
do we mean by second opinion? Because people who are coming here to my office have already had various opinions about this. And
Right.
here they are,
They're coming to you.
They're coming to have this done.
Right.
Are you saying that then we have to turn around and come go back to where
You
you
don't
came
have
from?
to.
Well,
You
no,
don't-
are you suggesting?
I'm
that-
suggesting in a
that they
real-
go back again a second time?
If you have some inclination to believe, okay, that this might be an informant, one of these guys that the state sends around to get all these treatments done, if there's any reason that you feel that you want to cover yourself, I'm just saying, if you refer this person back to the same person who sent them to you, say, well, look, it may not be a second opinion we're going to say, I want you to talk to your previous dentist one more time. I want you to have them tell you why didn't they do the same thing that I'm doing? And all I'm saying is, I believe, especially, and I guess the main thing I was talking about is, if you're gonna rip everybody's tooth out, if you're gonna do something real critical, I think that's where the second opinion came in the first place. If you're gonna say, in order for you to feel better, you have to take all your teeth out. Then, in cases like that, I'm not even for everything, but cases like that, I think you're gonna be covering your hind end if you not only send the person out to the dentist, but to another medical doctor, so that it doesn't look like you quickly flim-flam them into having all the teeth pulled out. And I used the example early this morning, how would you feel if your wife came to you, smiled, with no teeth in her mouth, and said, I've been told I'm going to feel real good for the next, in a couple of weeks I'm going to really be feeling good. I think you're asking for trouble. Now the person might go with a smiling, toothless face, for the rest of her life and not sue you. But I think you want to watch out for things like this. The more drastic it is, the more likely I think you want to go into something like this. I'm not talking for every time you take out a mercury filling out.
But for the more drastic stuff.
I'm just suggesting that would be a little easier to defend in court than something, we had a guy called Riviera in Columbus, Ohio. Did anybody hear of him? You heard of him? He's the mass tooth puller. You come in for $150, he pulls all your teeth out. So, if you say, well, if you can't afford my services, just send him over to Columbus, Ohio. They'll do it for $150. I think the guy was finally put out of business. I don't know whether he deserved it or not. You people would be more likely to be able to determine that than I would. But, what?
He cured his neighbor's PMS.
There you go. There you go.
How do you apply for an
IND?
IND?
You just, you write a letter to the Food and Drug Administration. And that would be handled by myself or an attorney for you. If you had another attorney, the attorney tonight would be able to do that. You could do it yourself. It's just that it's much faster. It might take, a half hour for us to write a letter off.
What do you do? What do you state in it?
You state, the purpose, what device you're using, what the purpose of the IND is, who the investigators are going to be. You don't have to have them all there, but if you're going to add additional ones on, you want to put their names on it.
Okay, now the device does not indicate a therapy. The device just...
The diagnostic device.
Right.
Yeah.
It just, it gives you certain parameters, and then you choose the therapy. If you choose to tear somebody's teeth all out, the IND covers what part of this? It covers the device, and then
And the treatment.
who determines,
And the treatment. You want to get the IND for both.
Yeah.
John, I'd like to just put on the record a couple minutes since I had the unfortunate experience of starting this meeting that we're going through here today 15 years ago when we started the chelation movement. And we thought then that it would be as simple as that, and we wanted to get our IND for chelation. It's only, we start out in a room with board-certified pathologists and board-certified cardiologists and university professors and people who are knowledgeable on it, and it isn't quite so simple. The IND that we finally do have has cost us at least $500,000. has taken the collective effort of everybody in the academy. My brother wound up actually donating 2 years of his lifespan with his phone bills running $1,200 a month out of his pocket, nobody reimbursing him. FDA today, in order to do something today, generally you're stuck with proving to a committee of experimentation that you're going to come up with valid data. To come up with valid data, you have to define your parameters extremely concisely. We're down on our chelation study to just measuring people who can't walk very far with before and after treadmills, but they can't have diabetes, and they can't change their cigarette habit, and they can't add any other therapy, and they can't change their diet, and they can't do this, and they can't do that. So I'd like to tell you that an investigation of new drug status is something that when I got the form in my hand, we all sat down around that room, and we were all the board of the beginning board of our academy, and we thought we were going to fill this out, and we're going to get this off and running, and there wouldn't be 15 years of my life wasted fighting with medical boards, because I fought with other medical boards in this country now, personally as a witness, in extreme fights with doctors' licenses on the line and things like that. And the issues with these medical boards are complex, but when I got into the fight in the state of California, to leave the IND for just a minute and come down to why the second opinion is an interesting concept. When the California Medical Association decided unilaterally to ban all chelation in the state of California, and a bunch of us were doing it, and they said that if we didn't stop, we would immediately lose our membership and face all sanctions that they could throw at us. Today, those sanctions obviously include when you're punished by the California Medical Association or your hospital, automatically that's reported to the board today. If you're punished by anybody, it's automatically reported to the board. And then the board automatically has to come out, and I brought a couple of newsletters of how the board just has increased their budget by 50% starting January 1, so they have 18 new investigators to the previous 100 investigators they had to infiltrate your office and come in as shills and to see what you're saying and to tape record you and to be sure we entrap you into losing your license in this state. So it's not a simple problem we're talking about, but to look at what happened when they banned it, I was very fortunate at that time because that was when Jerry Brown was governor. Jerry Brown didn't like doctors at all, and so he had put a very unusual guy in head of HEW. His name was Jerome Lackner. And Jerome Lackner, even though the medical board had already sent out a letter to every doctor, they had broken into my office in the middle of the night and forced their way into our file cabinet to get the names of all the doctors who were doing chelation. We know that because the doctors who were doing chelation got certified letters, the rest of the state only got a non-certified letter. So it's pretty clear that they knew who we all were. In any event, well, it's impossible because nobody else but me knew who all those doctors were. I was the one that organized the group, and my filing cabinet was jammed, and my brother was broken into.
You're immediately suspect.
Yeah, you can. So the thing is that, but coming back to the thought, Jerome Lackner, after the board had sent a letter saying everybody will take your license if you do chelation, you can't do experimental therapies in your state, is what the letter said. You may not do experimental therapy, period. So that was a little upsetting to us. And I went to Senator Campbell and a few of the other senators, and we got the Attorney General to give a legal opinion that showed that the state was taking our rights away more rapidly than we had under federal law. And so we were able to get some change in that. So the Attorney General did not back up Umpqua in that letter. But during those horrid days in which we were working 20 hours a day nonstop to try to keep our patients being treated, and people who were stopping treatment were dying, and things were bad, and doctors were dropping out of the movement, and legs were getting chopped off that we were saving in chelation because doctors stopped treating because they were all told they'd lose their insurance, lose their medical society membership, lose their hospital. So we were, a lot of blood was on the floor. Jerome Lackner happened to be an unusual guy. He's an attorney, he's a Jewish rabbi, and he's also a physician, board-certified internist. So he's got a lot of training in a lot of different disciplines. And he was honest enough to agree to look at the pile of data that I brought, and what he wanted to make it legal in this state was for me to meet with a bioethicist. The bioethicist is a very bright guy who happens to now be, frankly, very open and holistic. At that time, he was a state employee, and he played his game very tight. And so he looked at everything was published. He said, you can't do this treatment to any patient without you proving to me at the state level that they're a fully informed and consenting patient. which if you get into what fully informed consenting in Cobbs versus Grant and some of these other really wild cases, you could spend hours giving somebody fully informed consent because they need to know anything that's ever published. And when he found one article had been published in 1952 that when given totally inappropriate dose of EDTA, the patient died of renal failure, he made me require every doctor to tell every patient there's a distinct chance that he may die, even though we've given 1 million treatments under our stuff, and nobody's ever died using the correct dose. We still have to tell every patient this is experimental and you may die. So those are that's just how they play the game. But when you do have a fully informed and consenting patient, that was how we won in the state of Florida, because there the judge listened to us, and we had to take it all the way to the Supreme Court of the state of Florida, and the judge there said, society at large has enough to gain by the innovative physician who wishes to look at experimental and new therapies as long as he has a fully informed and consenting patient, that the judge in Florida allowed us to do chelation.
That's the Supreme Court.
That's the Supreme Court.
And that sets a precedent.
Yeah, but it's a precedent, but it doesn't help us here, because we don't have,
It sets a precedent in Florida.
Yeah, but we don't have a constitution in California like the one there. The Constitution in Florida specifically recognizes the opinion of a respectable minority, but in California there is no such language for respectable minority. So we have a double burden in this state, and we had an emergency meeting 2 weeks ago at the National Health Federation with all the doctors who are facing loss of license, and the group is large, and it's everybody I know. And the thing is that it is somewhat at crisis level. I think to explain to you why there's a crisis level, you need to understand I have in my briefcase, which we'll get into tonight, I have a letter that shows that Ralph Nader has done a study, the Ralph Nader group, of every state. And based on the number of doctors and the number of licenses taken, California is in the bottom 10%. We don't take enough doctors' licenses, they state clearly. So we have to take a lot more doctors' licenses, and that's why the University of San Diego issued the report to the legislature last year to totally change the medical practice way it was being run and to give them this huge new increase of salary, because they proved to them that they weren't taking enough doctors' licenses, that they were mollycoddling. It was the good old boy network. They take a lot of our licenses, because by scaring the other doctors and keeping them in the mold, it's pretty good. So anybody's practicing alternative medicine's got a high mortality rate in the state, but the other guys can pretty well maim people and have some pretty bad things, and they leave them off pretty easily. They can be on drugs and everything else. So that they've shown pretty well what's going on.
Gary, let me cut in right here.
Okay, good.
But
I just need to let you know a little bit about what's going on.
And I think it's helpful. I will say this, and this helps again in public relations and media. I mean, you don't have to necessarily just be talking about your therapies and so forth. In Columbus, Ohio, we had one physician who raped 35 or 37 women. The medical board refused to take his license away. For months, they refused to take his license away. And I think he had been indicted. He was going to court, and the most absurd thing happened was that he finally requested the medical board to take his license away before they did it. He requested them to take the medical license away. There's no question that if they're going to increase the number of people who lose their license, you guys here are going to be prime suspects. What they go after are people who challenge the hospital way of doing things, the establishment way of doing things, and there are people, who were getting away with murder. In the bill that I was talking about this morning, we had about 3 provisions that we didn't get in. We got 30 amendments to the Medical Practices Act. We didn't get a definition of medicine. We also wanted to slam real hard. We're going to increase to a felony a person who's practicing on the influence of liquor and drugs. And if you want to, this would be one of the things that I would go for, is get on the bandwagon with Nader and his group and say, we know there is many people, physicians, dentists, who practice on the influence of alcohol and drugs. It's real hard for bills that would slam the heck out of them. They get away with murder. We had one person who was the wife of the head of the Department of Pharmacology at OSU, who was one of the biggest drug dealers in the state. She had a license to practice medicine, which is using that to get pharmaceutical grade drugs and drugging a whole bunch of patients and selling these things, you know, in 30-gallon drums and so forth. I mean, just doing a phenomenal business. And she was finally caught. The medical board assigned to the case the board member from Ohio State University, who she got away with nothing. I mean, no penalty, nothing. I think he finally, she had to practice in some other state, you know, and so he resigned as the head of the Department of Pharmacology. The guy was a prince of a person. Dr. Bianchini knew him personally. I didn't know his wife was involved in drug trafficking, but I'll tell you, they protect their own. And the arena that you're going to talk about this, if they need a quota, the arena that you got to bring this to is to the public. I had one massotherapist who listened to a talk I gave on fluoride, who started recommending to his patients that they get off of tap water and use distilled water. The medical board came into his office, a representative from the, not the medical board, but one of the medical investigators came into his office, ripped his license away from him, which he didn't have the legal right to do under our state law. And his office was closed up for 2 weeks before he got it back again, just for recommending this patient drink distilled water. All right? These are the types of things I'd love to deal with. You know, and then I just, after that, I bring my Newsweek thing here, you know, saying fluoride causes cancer. And you bring these absurd cases to the public, and the medical board gets the pressure.
Sure they do.
And that's why I say, you know, the Lux plan, as far as I'm concerned, is the way to go, because it's like you know, making sure you eat plenty of fresh fruits and vegetables, but the rest of your diet is totally imbalanced. It's a total program. If we're in holistics here, I'm just hoping that we go for a holistic program if we want to do it. I mean, you don't have to. You may not have the need to, or you may feel that, you know, you just want to keep on working the way you are and see if you can, you know, the bullets are going one way and the other, and they've missed you so far, and just keep on working that way. It might be the way to go. It might be the more economical way to go. I don't know. I'm just saying, if you want this thing to grow, if you want people to have a better opportunity to know about the problems with mercury fillings, those are the types of things that really have got to go on radio and television and be broadcast, and saying there are a number of physicians who really believe that in most cases, maybe this is a good thing, I might be a good human, in many cases, I shouldn't say even in most cases, in many cases, a person's health can be improved by the removal of mercury fillings, and I'm one of the dentists in this area that does it. If you can do that, I think you're on your way to bring your argument before the public. If you're afraid to talk about it, except, you know, in some dark room somewhere, the shadows of quackery and so forth, and you know, some type of back alley dealer come out against you. The more open you are with this, yeah.
I think Gary Berrigan is ideal as a spokesman.
This is, everyone's going to nominate someone else here.
We're going to take a short break, and then we're going to come back. And I wanted to ask everyone, all of you that are non-members of the Academy, we welcome you to join in. And to do that, then you get all our back journals, so you can find out how we're limping along here. Thank you, guys. Let's take 15 minutes. Good idea.
He was here, and areas with the devil, and he says, now I'm going to take you to 3 places, and I want you to know, if you reject the first place, you won't be able to come back. You got to take one of the next 2, and if you reject the first 2 places, you're stuck with a third. One thing that reminded me was Dr. Arena's statement is back to work. Anyhow, he goes to the first place and he sees these people floating around with ice, and they're underwater and they can't breathe, and it's ice cold in there with naked bodies, just miserable looks on their faces, just being frozen to death. No, I don't want to be there. I need something warmer. The next place he's taken, it's fire and brimstone. It's just hot as can be, people sweating, burning, just torturous circumstances.
Like in Phoenix, huh?
Like in Phoenix, where there's nobody on the street. Everyone's in there. No, I don't know what horror you have for me in the last place, but I don't want any one of those 2. And then when he comes to the last place, he sees people waist high and fecal material, drinking coffee. And he said, "Oh, am I so happy I waited for this." He hops in, and then the devil says, "Okay, coffee break is over. Back on your heads again." It was that statement of back to work. Just make this joke up. Anyhow, back to work. I don't know how appropriate it is for this lecture, but. Gary brought up something that's very important. We've been talking about a lot of things. I think, as I perceive, there's some groundwork that's got to be done. I think we want to establish the things we want to have covered. I think as far as electroacupuncture, as far as mercury goes, again, I'd be willing to help you put these things together. I think we've got to have some type of cohesive thing that we're satisfied with and comfortable with to present our case. As far as the legal side goes, as far as the IND goes, Gary pointed out that
you've got to have very specific research that's going to prove something.
For an IND.
Or you're using people needlessly for human experimentation. In other words, they will not approve anything without a scientific committee agreeing that this will definitely prove something and that the benefit offsets the risk.
Right. And the major thing is that INDs have to be carefully worded, carefully protocol. Protocol is probably one of the best things that I do. I mean, I'm very good at setting protocols. I worked at Western Reserve University Medical School. I designed protocols there not only for myself but for others. I was supposed to be the protocol committee of this fluoride study, and I wasn't. But it was recognized that I do have that ability. I'm very, very, how should I say, very finicky when I set things up, that they're done. That it would be done in a way that's fair to you, but carry all the weight and all the rigor that they would need to get an IND. It is difficult for one person to get an IND done. Theoretically, it's possible. I mean, if you want an IND, you can write a letter. It is easier to use me or use myself and my resources to do it for you, with the help of an attorney as well. If Gary's brother could be of some help.
He's so burned out with having dealt with the FDA for the last 5 years, you couldn't pay him $100 an hour to work on one more protocol.
Okay.
It is the most heartbreaking thing you do, because every little thing that you think you know, something goes wrong in it. And we're now 3 years late on getting our study. We actually have people being treated at the Walter Reed in Washington, D.C. But we're exactly 3 years late and about $300,000 deeper in the hole, which has come out of all of us. We keep it. There's nobody else. It comes out of us. So it's been a very traumatic. You know, every time we have another meeting, he has to say, "I'm sorry, but we need another 50,000. There's been another crisis."
If that study is still going and you've got an IND for it,
Yeah.
how did they get that on the list of the 10 top quack cures or 10 top quack things that the FDA put out?
There's a guy who does all his reading. That is one of the wonderful stories of this world. The FDA is so big, so incredibly big, that we deal with Dr. Lepecki. He's the head of cardiorenal division, which is the division that makes all the approvals of all studies for all heart-related, vascular-related medications. Dr. Lepecki has personally written the retraction of that unfortunate thing. The FDA was in a position that we could have sued them, we could have done anything, but we're so tired. My brother saw no reason to sue them. He simply asked them to do a retraction. The retraction has also appeared in the Washington Post, but it just shows that that agency is so big that the left hand doesn't even know what the right hand is doing.
Thanks. Okay, but with the general plan of getting together and finding a common umbrella that will protect all of us, this is, of course, what the lecture was about. This is what our discussions have been about. I'm convinced that it will be extremely helpful. Now, Gary was talking to me and saying, you know, we get people all excited about doing something, getting something going, getting a show on the road, and then we all disappear and go our separate ways? Well, we might as well face the music right now. And the question is this: how many people here have practices in dentistry or in medicine or in fields where they feel they would like to have or pool their resources to get a fund that would insure them, would pay for their legal expenses? Raise your hand. Hold them high. Somebody count the hands for you. Ed, can you? And count your own.
Yeah.
20?
I got 12, 13.
13? Okay. We have 13. Now, of those 13, would all of you be willing at this time to sign a pledge? Let me tell you what the pledge I'm asking you to sign. We have a yellow pad right there. The idea is this, and I'm talking about the deluxe plan, and again, you might want to go with, you know, this type of plan or this type of plan. The deluxe plan, I think you're better off with. The deluxe plan has a range of $350 to $500. Again, talking to Gary during the break, the reason I want to have a range of $350 to $500, that fee will depend in large part on the quality of the attorney that you get. Quite sure I can get somebody for less than $350. It's not all going to him, but I'm saying that's a large part of what that cost is. In choosing this attorney, I would probably suggest that you form a small committee of maybe 3 or 4 people. I would recommend a couple of attorneys to you. They would have to come out here at their expense and make a presentation or see you and meet with you. I would give you a price based on each one of them, and then you would decide which one of the 3 or 4 that you want, or vice versa if you saw somebody. I would like to meet with that person also to see if you want me to help you out, if you want me to be involved, if I could work with that person, yes.
Are they knowledgeable attorneys in the field of medicine and dentistry?
I don't know any attorney that is, and quite frankly, I would probably be looking for somebody who's not that knowledgeable, who we could work with to start out with.
There's a dentist that is a member of the International Academy of Oral Medicine and Toxicology, who has now just completed his law school training, and is very much informed on electroacupuncture and homeopathy, and there would be, just save many dollars and much time and study because he is aware of what's happening.
Okay. Certainly, I would say that if you wanted to look at him and interview him or even hire this person on this basis, that would be up, it's got to be up to you because it's your necks that are going to be on the line in the first place. My recommendation would be to take an attorney who is extremely bright, who has a virgin mind on this whole thing, is not that well, how should I say, trained into it, and can pick it up rather than somebody who is who already has preconceived ideas. I came from a father who was in the restaurant business, and they had a Yale Culinary Institute in town. He had the largest restaurant in the state of Connecticut. It seated 700 people. Was located in Connecticut. And he told me, he said, rather than have a person who comes in with all these preconceived notions, all these ways to do that, I would rather have a person who I could take and mold myself, because in the end I get somebody who's better, who's not telling me all the time, this is the way we were taught at Yale Culinary Institute. By the way, my father's restaurant was probably one of the finest restaurants in the country. I mean, it was the biggest grossing restaurant in the state. Dan Broida, who is, anybody ever hear of Sigma Chemical? They're the largest manufacturer of biochemicals. Dan Broida, who was their chairman, started this company out of his garage and made it grow into one of the largest biochemical companies, said to me, he said, he knew I had a PhD, and Dean Burke was there. We were just before we were going into another court case in Illinois, across the river from where he was, in St. Louis. He had us over for dinner, and he was joking with me, but quite seriously. He said, I try to stay away from hiring PhDs. He says, because they're too well trained, so to speak. He said, I'd rather have a BS who is bright than a PhD. who might also be right. He said, I have to admit right now that the president of my company is a PhD. But aside from that, the reason I'd rather have a BS than a PhD is because if I have a PhD and I tell him to do a research project, he will invariably tell me why it's impossible and why it can't be done. He said, if I have put a BS on the same project in 6 weeks, I have a 50% chance of having the project done, while the PhD is still telling me why it can't be done. These are some of the fears that I have with a person who supposedly already is, how should I say, expert in the field. That would be a warning I would have to you. Plus, if this attorney is going to be doing things beyond electroacupuncture and homeopathy, I would rather really have a person who's trained in what we're not trained in. Court procedure, he's excellent in the courtroom, has his strengths where our weaknesses are, because we should be able to take him, reduce our case to something succinct enough that we can get to him and have him use his ability to play this in court, rather than a person who just graduated from law school, whose basic, background is in dentistry. That's my suggestion. But again, that I would leave to you as to who you would decide. I mean, it really has to be left to you in the end, because you're the people who are going to be paying for it. I can't determine what you want at the price. I mean, it's like asking me to buy a car for you. I come with a BMW, and you say, well, I don't want to spend that much. Or I come with a Fiesta, and you say, I don't want to drive in that car. You've really got to make that determination. You've got to set up. But you should feel, if we're going to go with a deluxe plan, that is the plan that you want to go with the understanding that this person is going to be kept busy all the time. He's not going to be playing golf on Wednesdays or something of that sort. And if he decides he wants to, he gives us 3 months' notice and we train somebody else. It's going to be tough. It's going to be tough.
How would someone monitor this person's work habits or ethnic or his productivity along the line?
In the plan that I was suggesting to you, I would be serving as your science consultant anyhow, or your liaison anyhow. And that would be my responsibility to keep on him, making sure that this guy was either engaged in lobbying, legal research, working on INDs. I mean, if the guy wants to get burned out, that's fine. I don't care about burning out these people. I mean, it serves them right, they're not taking care of their health properly. I think if a person's going to be working hard on this thing, they're going to have to. I mean, for lunch, I've been standing here just about all morning long. What I had to do, I knew what I had to do. I couldn't have lunch. I went out and took a run for maybe a little over a half hour and came back. You've got to learn how to take care of yourself. And I work people hard, but it would be my responsibility to see this person was continually moving and didn't have a spare moment. Except when cases for you would take precedence. So, in looking for a person, not only you want to look for somebody who can handle himself well in court, who knows the law, but also somebody who will be presentable as a lobbyist on your behalf.
Do you know of any other groups that have this kind of a working arrangement with?
Gary, you probably know that better than I.
Well, my own personal life has gotten to the crisis level that I recently wrote a small ad this size, the Sacramento Bee, for my own staff attorney. And I have recently gone through the process of interviewing a huge number of applicants. The ad simply said, needed full-time staff attorney for complex multi-party litigation. And I had about 30 responses. And I also put an ad at the Georgetown Law School, which is in Sacramento, where we just got one of our Supreme Court appointees. And I'm involved in so much litigation now that, for example, yesterday, the day before yesterday, had a meeting in which 5 attorneys are all on one problem. 3 of them I brought into it just to make the other 2 behave. And it's really interesting. I've worked now the last 12 years so much of my time with attorneys because I generally have had to be the guy to spring every doctor in trouble in the field of chelation, and it's been full-time trouble. So I've been in every state testifying, and I found it extremely complex, and I have a lot of reservations about any one person doing anything. I've had to sit there at their side during trial and write questions, because the attorney, we always have to discredit their expert witnesses. And so their expert witnesses are saying you're a quack for using zinc to treat this man's prostate. So I have to sit there and write to the attorney, please ask Mr. Smartass what zinc does in the body. You know, and so Mr. Smartass can't answer it. So, but he's the chief at USC Department of Pharmacology, okay? But then I have to know the legal tricks, because then Mr. Smart decides to say, well, can I refresh my memory? Because he's feeling pretty embarrassed in front of the judge that he doesn't know what the heck zinc does in the body. So then he pulls out a piece of paper out of his pocket. Knowing law, as I've been in the courtroom for 15 years, I say, Your Honor, we'd like a copy of that. Through the attorney, I can't say anything myself. Only once have I been turned loose and allowed to do the cross-examination. That was in Bowles' case. And it was quite a thrill, because I beat the heck out of the director of Blue Cross. It was quite a thrill. I missed my airplane. It was worth it. Because I got him to admit that what he wasn't paying Dr. Bowles for, the same thermograph, if we moved it across the street to the hospital for the same patient, for the same diagnosis, he would pay exactly. And I got him to admit that he didn't have the authority for that anywhere in the text, that he was doing that on his own. Didn't change the outcome. We still lost the case. At least we had the truth on the record. But when you start working with attorneys, every one of them is a different personality, and they will run hot and they will run cold, and it is a real problem, because the first thing you have to do is you've got to be able to discredit the other side, which means they need to have a lot of in-depth knowledge, and they have to have a lot of guts. And I think it's brilliant to have a full-time attorney, and I think it's dumb of all the groups not to, because they're cheap. I mean, really, got a guy who's been 18 years in law, graduated Loyola. He's been the head of Computer Science Incorporated, which was the outfit that did all the Medi-Cal billing for this whole state. So he's been in the medical-related field for years. He knows how to deal with the bureaucracy. But he's got more of a corporate training, so he's what we call a staff attorney. He is not one who will get out and beat everybody up for you. Staff attorneys think one way. He wants to keep his job with me, which means that he wants the thing to go along pretty much status quo. And therefore, when I want to take a very hard knock, I have to bring in somebody else, because he will only go so far. It's very different, the attitude each one will take. The guy that gives me the most experience is a guy who's been a top criminal litigator. He's had 300 cases to his background, 300 cases that he's gone to jury on. He's represented everybody from the mafia to you name it. And he has been in front of the medical board, because see, the problem is you talk to an attorney, most of the guys lie to you and they say they have a lot of courtroom experience, but most of them have very little. And if they haven't had courtroom experience, a lot, and I mean impaneling juries and arguing cases to juries, because just going and arguing law and motion means nothing. They got to argue, point to a jury and know how to solve it. But when you get guys that can do that, then you still have guys that are always looking at their political standing, they're looking at their peers. I mean, I've got some really complex litigation in which basically I'm having to do an awful lot right now. A lot of what I'm turning into is turning out to be attorney malpractice. Turns out most attorneys fly by the seat of the pants as badly as doctors used to do, until they sued the hell out of us. And so now very few of us miss brain tumors anymore. When somebody comes in with an unusual headache, we order an MRI. But the attorneys are extremely incompetent. When you take out a series, like I now do, of a case, and I put 3 attorneys in a room and I barnstorm a case, it always comes out the direction we go is 100% different from what you would have seen. And since I do consulting on all these cases, I spend hours. I spend 8, 10, 15, 20, 40, 60 hours just on a case, looking at every piece of minutia to figure a way to get the guy off the hook. And so far, I've been very, very lucky. We've only had one guy that really nailed, and I told him to fire his attorney the day I walked into the room. And he wouldn't, because his attorney, anyhow, was a good friend out in Salt Lake, and anyhow, he lost his license, and then we lost another license, but I wasn't involved as an expert. I just knew the guy was incompetent. I told the doctor, I said, if you don't fire him, you're dead. He's never practiced in the state of Kentucky. His attorney is now in jail. And interesting, as a jailhouse attorney, he's in jail, and other guys would like to get out. And so if you're an attorney in jail, they come to you, they don't touch this idiot. He's that bad.
Let me say,
but he's got a great line of gas.
Let me say
and he fooled a lot of doctors right down the hall.
That in your court cases, if the attorney appeared in your court case, I do exactly the same thing that Gary does. I sit there by his side. And it always works out well. When the Scottish Legal Society brought me in at a fee of $500 a day, and it ended up being a 2-year case. when for 2 years I was commuting back and forth to Scotland for 2 years. I was there right at the Queen Council side, listening to the questions, and about every second or third question was a question that I fed through the Queen's Council. And I have no problem dealing with, through legal counsel. There's one thing, I'll tell you, and Gary probably knows this too, when you're dealing with with a lawyer or counsel or whatever you want to call them, you've got to respect the space on them too, because their mind is going one direction. If you keep on plugging questions into them, you can throw them off track. So what you do is develop a little team between the two of you. You have little signals of when, questions shouldn't be put in at that time. He'll tell you, you'll know without him even saying it that he's got to continue along his particular line. But to expect to get a lawyer who's going to be as sharp as the person whose professional background, you can't do it. It takes a two-man team to do it, or a two-person team, ladies in the audience too, to do it. And ideally, it would be good to have one attorney full-time, one attorney part-time, just in case there's a problem with the first attorney. He can drop and pour another one. We had a court case in Pittsburgh, Pennsylvania, where after 19 days we were able to show, after the National Cancer Institute came in, National Academy of Science, Royal College of Physicians, Royal Statistical Society, we wiped them out in the case. In that case, I worked with a gentleman one lawyer who did beautifully that case, just did phenomenally. We went into another case in Illinois. I had him in the local counsel, and my attorney sort of in the middle had what I would consider a nervous breakdown because he couldn't take the pressure anymore. And these things get real heavy. And so because I was managing the case, I put the second chair in the first chair and had him continue to the end of the case. It really helps to have a spare there, just in case. I mean, the guy can, a spare attorney who can follow up if the first person dies. This person can take it as a full-time and getting another one. Normally, when we start out, we're going to have to start out with one at a time. And this is why I say you want a person you're not worried about his background. I could probably, the Queen's Counsel, I mean, I think he was the son of the most famous Queen's Counsel in Scottish history. Unfortunately, he was no reflection of his father. He was better than most attorneys in this country, but nowhere near as good as our opposing attorney, who was the Attorney General for Scotland, former Attorney General for Scotland. Really a super attorney. I have in this country about 19 attorneys who work for me and do a lot of pro bono publico work for me, and other ones that I have to pay. But I think even from the ones that I have right now, I could probably suggest one or two real good ones, if they'd be willing to pull themselves out of their practices now and devote themselves full-time to a program like this. I know one in particular, who would love to do it. I know another one who is now a judge, who I really think is phenomenal. I don't know if you know what law review is. They take the top student in the senior class and make him editor of law review. This guy, editor of law review, he's got all this stuff together. And by the way, it just so happens he's in homeopathy. His folks are in homeopathy. He's an excellent attorney. He has done pro bono publico work for me in writing briefs. He's the finest brief writer. Very logical in his presentation. He's not a Melvin Belli in yelling in court, but he makes his points, and he's good.
John?
Yes.
If the progress of an attorney is monitored through you, the second part of Gary's question then is, how does the association monitor your progress as an intermediary?
By probably having a board, an oversight board, where I would have, constant contact with. In other words, I'd have to report to them. It would be nice if you assigned one person to me where I could be in contact with 3 times a week. And maybe the board, once or twice a month, to monitor what I'm doing and telling you what I'm doing. Right now, I'm involved, quite frankly, in a campaign that's going to keep me busy for at least until July 4th. And there's no way I could ethically, even begin. I can begin to help you, tell you what has got to be done between now and then. The lady, Linda from Spokane there, mentioned, you probably have some work to do here. What I'm trying to get out of you right now is not necessarily, tomorrow you have to plunk $500 down the line a month. But what I'd like to do is have you sign your name across the paper and say, yes, if things work out, I am willing to enter this program, but it'll cost me $350 to $500 a month to be covered fully for legal. Yeah.
In the scope of this group, how much could the person bite off in terms of, would it be just amalgam plus electroacupuncture? Would it be herbs and homeopathy? Would it be some physicians too, or what?
Okay, let's talk about that. And that also affects the 350 to 500 range. On the last part of the program, it says payment of legal costs. Now, before I get into the areas that we're going to cover, let me go into the types of things. Let me go into your question first, and then we'll go into the other parts. This is something that you will have to determine for yourself in the next couple of months, what you want covered. Do you want electroacupuncture covered? Do you want mercury amalgam fillings covered? You certainly want everything in general covered, I would imagine. Electroacupuncture is going to be probably, how should I say, the hardest thing to deal with. And well, let's put it to the people here. How many people want electroacupuncture covered? Okay. You have electroacupuncture covered. We'd have to do that. Mercury silver amalgams definitely. If you're going to cover electroacupuncture, how many would want to have tooth removal covered? That's part of the electroacupuncture thing anyhow. I mean, I imagine you've got to set down all the types of things. Not only set them down, but you've got to develop a story around them. In other words, you've got to tell what your position is on this, what you're going to be, what you want to be covered for. If a person is going to remove a tooth by electroacupuncture with a claim that it's going to make a bald man grow hair,
Sure, it does every time, John. You do it.
well, you're going to have to put this down because you're going to come back to me and say, okay, these are the things we want covered, and you have a person taking out a tooth because they claim it's going to grow hair on a person's head. I'm not going to put it off, but I'm going to say I want to see something. Do you have any evidence on this? Or?
Usually it just brings the sex life back. It doesn't always do
That
that.
really does. But I'm serious about this.
That's covered later with photon therapy.
Laser photon therapy, right. But no, these are definitely the things that you're going to have to decide. We might still have time to decide it. But let me get into the other dimension on this. We're talking about payment of legal costs. And these are the following. I would assume that you want civil for sure. And you probably want criminal as well as civil. Right?
Why? What is that?
Because they call it fraud when they come after you.
Yeah.
Well, civil case is a person sues you for $500,000. Criminal is the prosecutor has you indicted for fraud. That's criminal. So it's criminal offenses or civil offenses. Civil offenses are offenses against another person. Criminal offenses are offenses against the state, where you can spend time in penitentiaries. And this is what I'm talking about, payment of legal costs, criminal versus civil. These are the things you probably want covered. Lawyer fees, definitely, you want covered. Expert witness fees, you want that covered, right?
Right.
You won't be able to put enough of a kitty together out of this to cover all expert witnesses because depending on the field, they're pretty expensive.
They can be, yeah.
Like $3,000
A day. So again, you might want to question whether you want expert witness fees covered, because if they were covered, then we would have to limit the expert witness fees based on our budget.
Could we get Lloyd's or somebody involved to cover the possibility that some of this injury? Provide us money that if we did get in trouble, that they would help pay the legal things for?
For which, the whole thing, or?
No, not for all the research and everything you're gonna do,
Yep.
but if you've got 100 guys in here, the chances of maybe 5 of us going down might be a bet that Lloyd's would take over for us. And say, we'll give you $1 million if one of them goes down, up to $1 million coverage.
We probably want $1 million premium.
Well,
Right.
I don't know if that would be true,
But that would not protect, that might handle a civil, but it wouldn't handle a criminal.
well, you're gonna need a criminal attorney too. In fact, what are the chances of one of us going down as a criminal?
very high, because that's what they throw. That way it gets out of your malpractice and puts it on your back, so that you have to be, so that they always look. They're gonna take the attitude that much of this is fraud, as far as they're concerned.
Well, let me tell you about expert witnesses, and this is where having me helps a little bit. I have a lot of expert witnesses who know me from the past. When you have a person like me, of course, I am an expert witness, so I'm one of them. I'm one of the bad guys. I don't charge $3,000 a day. I charge $1,500 a day when I appear as an expert witness. Of course, if I'm in your cases, I'm appearing as an expert witness for the fee that's involved. There's no charge for me. But in addition to this, I can bring other people in on your behalf. This will help appreciably. Whether you want expert fees covered or not, is, you know, as I get down the list, I get more and more things that shouldn't be covered. Next.
Just to tell you, John, when we've got into various things where we had to defend doctors who, if they went down, the whole academy would go down. And we had a matching thing, a lot of things, and a sharing thing in which the doctor paid this much, and he got some help from the academy, and that made a big difference. So it doesn't have to be, I think each case, the doctor who's on the line is gonna sit there and say, hey, if it's an additional $3,000, I'll sell the car I got, I wanna have X as my expert, but maybe we wouldn't all agree that. So I think that we have to leave some individual choices, and I think we shouldn't plan that it has to be 100% coverage.
No, I would agree with that we might consider having some expert witness fees, a minimal amount of expert witness fees to be drawn from this. But then if it became excessive, it would have to be up to the person who's being sued to determine whether he wants a $3,000 or $5,000 person. Because there's no way I can bring a $3,000 to $5,000 or a group of $5,000 people in at this rate. And yet I'm trying to keep the rate low enough that it doesn't turn you away.
Or maybe give it some running time, like maybe in 5 years this thing really finally gets used.
Then we might be able to cover that.
Yeah.
You know, I don't care, because when the fund runs out, down at least to legal fees, now, and my fees, then it would be, you know, we don't have this money here anymore. We've got to have expert witnesses brought in. Then you have the thing about travel expenses, which I think are petty. You know, the idea of flying a lawyer in or flying the witnesses in. I mean, you're really beginning to nickel and dime the thing. Printing costs, which is even more petty, which, you know, might range anywhere from $100 to $500 depending on, and the court costs, which is absolutely absurd because court costs end up being about $25 to $100. Have you ever seen higher court costs?
Well, court costs, you know, normally that includes transcripts, and the transcript of.
Okay, transcript is something different.
For the last 6 days, so.
Transcripts.
It's running $800 a day to type up depositions.
$800
Yeah,
a day?
here, depending on how fast you get it, you can get it as low as $400 to $500.
And I'll tell you one thing, if I'm managing, it's not gonna cost you $800 a day, I don't think.
Okay, but it's getting ridiculous. The whole thing is getting so out of
Court
hand.
reporters are gonna get $40 an hour to start with.
That's paying them, but I'm saying in the typing per page.
But
I mean,
is the typing per page usually about $1.50 a page what they charge?
that's a lot more than that today.
Here?
Oh, it's ridiculous in California. They have a neat union.
My goodness.
$3 a day.
More.
You know, these types of things, these are the types of things I really think, expert witness fees in part, travel expenses, printing costs, and court costs. And when I talk about court costs, I'm talking about a $50 fee. If you want that plan to cover it, it's not gonna really affect it at all. But these are the petty things that I don't think you really have to be covered for.
No, I think we should leave, because it's gonna, you know, it isn't wise to put a plan together that says the doctor has no risk, because then he gets very careless. I think we've got it on the basis that it's just like patients abuse the policy if it doesn't cost them anything to see the doctor. So I think we might as well let the doctors pay a significant amount, 30%. Why go to a 100% plan? But it's to our interest collectively.
It's not a 100% plan. You know, what I was suggesting, court costs, printing costs, transcripts, travel expenses, and a part of the expert witness fees would still be borne by you. But you would have a lawyer, you would have myself as a science counsel and expert witness for you. And I would prevail, even if you had to pay some expert witness fees, I would prevail upon some of the people that I have contacts with, getting these people cheaper than they would otherwise come for. I mean, they're personal friends of mine. I just say, look, I'm in the jam, you need me sometime, you know, I'll cut my price to you, you cut your price to me. And I've done a lot of this for other people, so, and I have no problem, yeah.
How does it work logistically when we each have our own liability insurance? Who the carrier has their own attorneys and team, and you know they want to handle a case.
Mm-hmm.
How do the two mesh?
Okay, it's up to you. If you want to you know, be represented, let's say, for example, you have a liability action or something like that, and you feel comfortable with what you have, I would definitely go with them. If you're not happy, you don't feel they're representing your interests in the case, then you come to us, and we would have a meeting with them and find out what's going on. Then we would basically serve as your representative to them. Because sometimes what the insurance company's interests are not the same as yours.
Right, sure.
There are, I would like to have, if I'm sued for $1 million, I'd like to have a person defending me.
Just to tell you though, the cost of any litigation, $100,000 doesn't buy you much of a trial today. And just, for example, to file a brief, because Jim Privatera filed a brief to take Bumpua into federal court on the basis of the illegal restraint of trade and other things, and to have a good, competent attorney really take the medical board of a state into federal court, which we want to do a lot more, and I'm in the process of trying to enlarge that, because another doctor in our city's lost his license, and I think it's one of the best cases for illegal restraint of trade I've ever seen. So that we're taking the one that the other guy wrote, but the guy was $40,000 to write the one he wrote. And now we're taking and modifying that and amplifying it, because now we've got all the responses of the state to try to defeat that pleading and that complaint. And so now we can know what their answers are in advance, and so we're going to get better. And so that's why this collective idea, it really needs to get to the point finally that we have a group of people who are swapping these cases, because there's so many cases happening in the country today, because finally medical boards are involved in the quality of care. It used to be they mainly took doctors' licenses for something that was really egregious, like he was drunk, or having intercourse with a patient, or was on codeine, but now it's getting down to what the doctor does, and that's true nationwide.
Let me give you an example as far as court costs go. I'm a stickler. I try to get more than my money's worth every time. All of us try to do that, but I'm really a dirty bird that way. We've had two cases, one that ran 20 days in Pittsburgh. We had tons of transcripts. I mean, I had the transcripts. They're about this much of transcripts. That court case, under my management, ran us $50,000. 20-day court case. And we won it. And we won it as a plaintiff. Now, I'll tell you, there's a difference between when you're a plaintiff and defendant. A plaintiff has got to prove their case either by preponderance of the evidence, that means if it's a tie score, you lose. We've got to win by at least 1 point. Or clear and convincing, which is more like a 65 or 75%. In the United States, we've had 4 court cases. We have won 3 out of 4 of them.
What kind of things?
These all been fluoridation cases.
All fluoridation.
As a plaintiff.
And has anybody become court case law that can do anybody else any good later on somewhere else? Like if you win in Ohio, can you quote it in Oklahoma?
No, you can't do that. But if you appeal it up to, if you appeal it to the federal court, you can.
U.S. Supreme you can.
Pardon?
If you goes to U.S. Supreme, you can.
Oh, yeah, yeah.
Not just from state to state, no.
But now let me go and give you the case that we did in Scotland, where I didn't manage the case. I was there just as a paid employee. I was there paid to sit at the elbow of the Queen's Counsel. $3 million. The most expensive court case in their history. $3 million. So there is, of course it was, the Scottish Legal Society on one side, which is taxpayers' money, which is paying me, and our comrades. And on the other side, it was their Health and Human Services, or Social Service, they call it Health and Social Services, the Department of Health and Social Services, paid the other side. They spent $2 million on the case, on their defense, and we spent $1 million on our side. And we lost the basic principle of the case, but we won the case in the end because of the technicality I pointed out this morning. But these are the types of cases. You can drag these things out forever if you want to. If you're a lawyer, it sometimes pays you to drag the case out. However, if that person wants to get out of the courtroom, has got other things to do, they're going to try to end the case, they're going to try to win the case in as short a time as possible. And believe me, you can draw cases out or you can shorten them up. It's got to be clean. The other side can make things a little difficult for you. I mean, they don't give you things you ask during discovery and so forth and so on, but that always helps you anyhow. You're the defendant. I'll tell you, I've always been in plaintiff cases, which is hard for me. But if they want to delay the case, as far as I'm concerned, they can delay it for the next 50 years. Because while it's being delayed, you've got to have this feeling. If somebody sues you and there's litigation against you, as long as you got your legal people there, you're confident that your legal and scientific staff are doing the job for you, you got to go back to work and just forget about it. And if this thing hangs on till 20 years after you're dead, you shouldn't have to worry about it. If you can't get into that psychology, then, you know, get out of the medical business, get out of the dental business. It's not going to work. If you're going to be sued, don't worry about it if your staff is doing the job. You worry about it only if you lose the case.
Heck, I worry about what they charge. I worry about the fact that the attorneys are making $200 an hour and filling in their notebooks and not doing any work for it.
Right. That's why a staff attorney is so important. Because they're not being paid that. They're being paid $50 an hour.
Now, there are some MDs in this that are from other states, et cetera. Will we be able to partake in this?
Absolutely.
Okay.
The attorney, it would be nice to get an attorney from California, no question about it, but the
Yeah.
attorney could be from Ohio. The attorney could be from Pennsylvania. He'll be serving pro hoc vici anyhow. No matter where he goes, you're going to want to have local counsel, which is another fee you've got to pay a person to hold the case and so forth, and file the basic fiddly stuff. I mean, that's you know, to the level of submitting a deed to the court reporter's office or the county reporter's office. That's not important stuff. The important stuff is when you bring your gun in, he's going to give you the courtroom time. That's the dollar per hour you're going to be saving. When the other person comes in and says, you know, I want to introduce to the court so-and-so, that's called pro hoc vici. And then your attorney starts, and that's the end of that. The guy walks off into his office. If there are things that have got to be dealt with, walking things around rather than having somebody fly in from Kansas to California or from California to where are you from? Oklahoma. It's much more cost efficient to have a local counsel who will just be filing these papers for you.
And would you describe the exposure that I have there in Oklahoma? I take care of food allergies, I do the yeast problems, things like that. So they're going to be what, coming after me against malpractice? Or are they going to come after me? I'm not aware that I have that much liability. It's starting to worry.
Mm-hmm. Oh, you don't think you have much liability?
I will hold myself up as not feeling that I have that much. Right. I know that I'm a controversial doctor there, et cetera.
Yeah.
But what do they do?
What does who do?
Whoever it is comes after. If it's the state board or something like that.
State board.
Or they come after your license, most likely.
Okay, license, take the license.
Yeah.
Okay. And isn't that just a hearing and a board and so forth? It isn't a legal matter.
Well, you want to be represented by an attorney in that.
In front of the board.
Right.
You don't
Were
want to
you-
go to any potential disciplinary proceeding without an attorney. I mean, that's the new law in our state.
Okay, another case. A person comes to
You
you.
don't go to a hospital staff meeting, you don't go to a medical center, you don't go to anything without an attorney.
Well, this
So I don't
covered that,
appear to
Tom.
be too much of a lamb. I do have an attorney who's an MD that I've been feeding information to him all the way along, and we have created, quote, this war chest.
Good, fantastic. Because you're in a very aggressive state. Oklahoma takes 5.21 actions per licensed physician, whereas California takes 1.23 actions per licensed physician. The worst state to practice in is West Virginia, where they get 8.58 actions per licensed physician.
Right, but I also know that this attorney that I use, this attorney doctor, who's a fine doctor, et cetera, you know, charged a guy $9,000 just to get him back on a hospital staff that approved him and then disapproved him over treating, I think he had chelated his father.
Okay, well, that kind of stuff, if he hadn't gotten him back on in our state, once you're disciplined by the hospital, it's now law that the state board has to be told that the hospital is upset enough about you, so the board then comes in and has its own separate hearing. And so there's two trials over the one issue.
Yes, I'm aware.
John, would that cover this then?
You familiar with Warren Levin's
Yeah.
story in New York?
Generally, not specifically, but I know that he's been fried and that he made it out okay.
Yeah, well, that was over vitamins and minerals and wild and crazy things like Heidelberg Gastrogram and some very ridiculous things. And that was the only reason they got out of that was because they discredited the major witness against him.
And not a single complaint in his file from any patient in New York.
Yeah.
I I knew that. But they just discredited what? They discredited what?
All we got did, we got rid of Victor Herbert. We've been gunning for him for a long time, and this time we got one attorney up to speed, finally. I've been against Victor Herbert in many trials, but this time we were prepared, and the judge, we just asked one question: are you prepared to have a unbiased opinion in the case of Dr. Levin? He said, I believe so. And then we took his own statements when he'd been testifying in other states, and he said Gordon and Levin were the two doctors he had to get the most in the country. We just took those statements, showed it to them, and the judge had to say that you're disqualified. You have already made your mind up before you got the data on the doctor.
That was the only thing that saved Warren Levin?
That was what saved us. So we have nothing, no trial on the substantive issues. We got rid of their expert, and they had not planned to lose their expert, and they had no other expert in the wings. And they had to say, we're sorry, the state's case against Warren Levin hereby rests. And that was the end of it, but all those issues will be tried again.
Gary, what court was that in?
That was in New York State Board of Medical Examiners.
Okay.
That was an administrative hearing.
Okay. That's why you have to have an attorney in administrative hearing. And you have to have really somebody who knows something about it, not the defendant at the side of the attorney. The defendant may be on one side and the scientific advisor on the other side. But you've got to have the team. It's very difficult because you're dealing with something that's interdisciplinary here. We're not talking about a divorce court. We're not talking about somebody's automobile striking the backside of your car. We're talking about something here that takes two skilled people, and each one should be skilled within their own area. As far as courtroom experience, I probably had more than most trial attorneys because in the Scottish case they dragged out for so long. So 100 and some odd days of court experience. And 20 some odd days of which were when I was on the stand. But this thing that Gary's talking about, recollection, or refreshing my memory and all this type of stuff, they could bring things in that otherwise they shouldn't be able to bring in. Rules of evidence, all these things, I get to pick up. I don't like the idea that I know it, but I don't have to know it. We should have an attorney who knows this anyhow. The good thing about my knowing it is if I'm working with an attorney and we go into a court case, or we go into a mock hearing, which I want to have with and this guy doesn't know what he's doing on rules of evidence. These are the types of things that you've got to know. Luckily, I have a daughter now who's going to be graduating from the University of Oregon. To show you what these lawyers get. This is a gal who, she's about 22 years old now. She's graduating this summer. She's walking into a job with $55,000 a year. Right out of law school. She's going to be doing casino law in Las Vegas, Nevada. Yeah.
Not to stop what you're doing, before you quit, I'd like to hear, since indeed this fluoride issue is in the balance, what is your agenda that you want to get done by July 4th to totally win this thing? It seems a little phenomenal to me.
Well, I know.
What has to happen?
What has to happen is I've just got to get enough funds together and get the PR together. And what I'm pushing for is to have, as is already being discussed, the Environmental Protection Agency set a maximum contaminant level of fluoride in the water at 1/2 of a part per million. As soon as that's done, it probably will be an emergency issue. And that's why they're having this meeting here or down in Tampa, Florida, is they're trying to discuss now that fluoride has been shown to be a carcinogen. As soon as fluoride is shown to be a carcinogen, the maximum contaminant level goal, MCLG, automatically is set at 0. Okay? And the only other thing is they have to set the MCL as close to 0 as possible. I'm on the record as having accepted a 1/2 part per million as a maximum contaminant level that wouldn't make it too onerous to many communities that have naturally fluoridated water. And in areas where it goes above that, provisions have to be made to either warn the consumers that it's above the MCL, or number 2, to actually remove that fluoride from the water that occurs naturally.
Is this a legal step or a political step?
It's
or
an administrative
public
step.
relations?
It basically, I'll tell you what it is. It's the same thing that ALAR is. It is a public awareness step. We have got to mobilize public awareness and public opinion so much that people are going to be screaming, yeah, my kids have these white chalky spots in their teeth. 10,000 cancer deaths a year. This thing is causing cancer. Now we have data showing that it doesn't even reduce tooth decay. And we've got to play it up big in the media. Normally, I go for initiatives, referendums, I testify in front of city councils, as Gary probably has, and state assemblies. There may be some states that have put out laws prohibiting the addition of fluoride to the public water supplies, done as emergency measures while this whole thing is going. But my whole goal is to get this thing done at the EPA level. Now, the EPA is going to be having two of their leading snakes, Joseph Petruvo and Michael Cook. And I call them snakes because in my opinion that's exactly what they are. They have in the past covered up harmful effects of fluoride. And now they're going to be talking to a bunch of people who are, waterworks people, telling them that, don't worry too much about it, but it could be that in the next couple of months they're going to stop you from adding fluoride to your water supply. Even worse than that, in some of the naturally fluoridated areas, they're going to make you immediately take fluoride out. You've got to be prepared for this. That's what this meeting is going to be about. While he's telling them that, I want to tell them, I want to have the funds to have a booth there with my books and, nice charts of the fluoride cancer, link, the latest studies and the fact that fluoride doesn't reduce tooth decay. Gary's probably saw, I have a graph. This is what the fluoride cancer link graph looks like in crude cancer death rates before adjustment for age, race, and sex. But you can get a general idea of what it looks like. This is the number of cancer deaths. This is the year. Two groups of cities have comparable cancer death rates up to this point. Then one of them becomes fluoridated. It goes up like that. And the non-fluoridated continues like that. And you've seen the chart on the tooth decay. Things like this to get the waterworks people to say, look, we need help. And I want to tell the waterworks people what scoundrels are going to be speaking to them at that meeting. And then to recover some of the costs of going down there and testifying there, and raising the question with these people, get funding from them, sell a couple more books, and be on our way. And maybe getting media attention there also. Now, Scripps Howard is in constant contact with me. Newsweek magazine is still following up. NBC may be getting online. CBS is extremely interested. This thing is not going to end. It's going to continue. Now, I'll tell you two newspapers. I heard people talk about these newspapers many, many times. The Washington Post contacted my friend at the EPA, the president of the union there, for a story, but it never got printed. New York Times. These are two very establishment papers. Put an article in there, but was extremely apologetic for it. And again, against these newspapers, we're going to have to mount a public opinion campaign to get these newspapers, which are very influential, start telling the story. But we're going to get things like the St. Louis Post-Dispatch. We're going to get things like the Denver Post. We're probably going to be getting things like the San Francisco Chronicle. I think we already had something going in it. We have a network. There's Wendy Nelder, who's one of the county commissioners or city councilman. There's a city county supervisor Nelder. Who is now becoming active. The whole thing, this is pulling people out of the woodwork. I can't tell you why these things happen. If I remember to bring my business cards, I have on there, I think, what do I have? Something about, I can't remember. I always say.
Have gun will travel.
Have gun will travel. Close to it, yeah. But performing miracles is my routine, something of that sort. Yeah, sometimes I don't even know. I know I do a lot of planning. And I knew that this thing was coming. Even before I knew that the Medical Tribune reporter was going to put it in his newspaper, I knew we were getting real close. When I got from the Freedom of Information Act the data showing fluoride was cancerous, showing that Procter & Gamble study showed that fluoride was cancerous, and then at that time we said July 4th, 1990 as a deadline. I'll tell you, I can't really take much more. Overall, and this is a summary statement I can say about fluoridation, it's chronically poisoning over 100 million Americans in this country. It's responsible for a large number of the 40 million people who are suffering from arthritis now. 8 million children are so badly being poisoned by it that they have the white chalky spots in their teeth. 2 million people are suffering allergic reactions from it. 35,000 people a year are dying from it. It's 100 every day. And 10,000 people are dying of fluoride-linked cancer deaths. And every day that passes, I mean, I just can't take it. I'm gonna have to say July 4th, if the thing isn't basically over at that time, I'm out of it. Because of the drain of sitting there realizing that 100 people, I mean, think how fast, how much, how long, and how hard would you work, knowing that every day that you weren't successful in stopping fluoridation, another 100 people were dying. Just that fact alone has kept my adrenal levels up. I just had them checked on the meter there. You checked them? Yeah, you saw how high they were, right? Yeah. I'm gonna run out of adrenal if I don't quit by. So it's as much a factor in that I think it can be done is that I don't think I can stand the stress of being under the gun, of being, as Science Magazine says, the leading, opponent of fluoridation in this country. I cannot be responsible for not getting this thing done before July 4th. And by the way, we're having a victory party July 4th at my farm in Ohio if you want to come.
Now, where is it that you want it to go at the end of this month, is it?
Oh, actually in about a week or so, down to Tampa, Florida. It's the Association of water engineers or something of that sort.
Okay. Well, I know this is an immediate thing for you. You want to get some funds to do this. What I would suggest is first of all that on going home on the airplane, that you write a letter that you would send out to every one of us in summary the points you made and the Class A plan or whatever. You don't have to go to the other plans.
Right.
And ask them if they would just like to contribute to get online and do this. Not only are we going to offer it to this organization, but we'll offer it to, we had about 80 members last year. And I think we'll end up with the same, and there's a group of a lot of physicians that they need to be made aware of it. And I think our academy can afford to mail this out to them, maybe with a little extra cover explaining to what the benefits of doing that might be. Just one page of concise writing, and then a little bit of the mechanics of the plan on the second page, and that's it. You get it to me, we'll get it out there, and you may have all the money you want. And because we've got to do something, and we can sit back and look at it and say, well, let's go with something. Bill Moore, they're going to come up with another kind of a plan. They're not here, so we go with what's here. And we've got to do something now, or individually we're all going to be history.
One thing I would like you to do is put your name on one of those yellow tablets, and just say, I would or I would not be willing to go into the plan as described. So
How
we
long
have
does this plan
some-
last?
Pardon?
I mean, how long is this
is
an
it
indefinite
open-ended?
thing? Is it just keep on going?
It's
Well,
open-ended.
until the troubled times cease, until we win. Until they make it a law, until they revitalize the Constitution,
Or-
until our rights are protected.
Or until you want to pull out.
Yeah.
We know for $1 million, we can do a referendum in this state that would solve the problem, and just all we have to do is just take the Helsinki Agreement, which was signed by the United States, which absolutely guarantees that every citizen is allowed to have any form of experimental therapy that his physician chooses to give him, but that would cost $1 million in just this state.
We all have patients that have some money that they don't really know what to do with. And they appreciate what we've done for them. Let it be known to them that they can help this cause if they would like to make a donation to a nonprofit organization. Now, I don't think they can do it to them, but they can do it to us. Mainly would you be considered like political action committee?
Well, no. What we are, I mean, you're talking about safe water, or you're talking about the legal fund?
Yeah, maybe you might explain a little bit on the difference there.
Okay, the legal fund basically is something that is on your behalf only. I would think that along with this, the expertise that we have and develop within the legal fund, we could just as well with your nonprofit group work, because I mean, I've conducted these referenda initiative issues in a number of states around the country. The expertise we develop and the overage that we have and the fees that you pay, two things can be done. We can eventually, as more and more people go, we can slightly reduce the fees. But in addition to that, we can use those fees for lobbying and getting some of the things done that might have to be done by ballot in the legislature itself, because we can pass legislation. We can have You talking about a constitutional amendment?
Well, yeah, in the state of California, I passed the bill, and I was the only expert witness that exempted the giving of nutritional advice from the Medical Practice Act, but that was before the CMA became so terribly powerful. They now own every legislature, excepting Montoya. I guess they don't own him anymore.
He's dead.
But, no, exactly, but the point is that at this moment, I don't hold out any hope to anybody that we can get anything past the CMA, that in any way would open up the restricted freedoms we have. But if we took this recommendations from the declarations of Helsinki, and we simply made this as a referendum, that would take care of this state, because it simply says.
But it won't help our friend in Oklahoma here.
You got it, exactly.
Right.
So that's a separate problem, we'd have to
Separate
define
problem.
some of these goals. Some of these goals will have to be different state by state. But I think there's certainly a need for a doctor's legal defense fund, and I think that's one project. And I think a separate project is getting you the credibility that destroying fluoride would put, because it would make him an internationally possible candidate for front page Time
Now,
magazine.
as far as, not getting us too confused, as far as donations to Safe Water Foundation, for those people who want to, and I will be asking for it, as time goes on, those are tax deductible because we are a nonprofit consumer healthcare.
Well, what we need is a modern day trust buster, okay? And maybe John and the attorneys will be it. So, but everybody has to kind of mull this over and on their own individual choice. I think maybe that we ought to chip in and get John one of those Kevlar